For us to provide HMO insurance for our employees there, I think it's something like $60 a month per employee. That's it.
Well, in your experience, so it's funny, you were talking about flying in different countries. I guess
Yeah.
that's from personal experience. They say you want to be able to see whatever doctor you want to see. That's obviously not the case. You can see whatever doctor you want to see that's in your network, but not any doctor you want to see. So, did you feel the quality and everything, and the timeliness of being treated was on par?
I mean, generally speaking, I think it's good. I wouldn't say it's the best in the world, but I'd say it's good. Would I rather pay 80% less and have good? Probably.
Yeah.
We would
Well, and
probably be
funny, the
better off.
definition of good is, I think, for debate.
Yeah.
We talked earlier about this whole transparency and coverage rules, and a lot of these big, companies that do this transparency work, the Talons and the healthcare blue books of the world, they also have a big focus on provider quality, and they do scoring around providers.
And we're back for another episode of the Startup Hustle. This is your host, Matt Watson. Very excited to be joined today by Markus Waite. He's the president of Empara, which is a Goodroot company. He's also the CIO of Goodroot. They have all sorts of different companies that do different things in healthcare. We're going to talk about healthcare technology today. Most of us that use healthcare are not very excited or happy with it. So hopefully Markus is going to tell us how to solve all of our problems and save ourselves some money on healthcare. Actually, if we could just fix our entire healthcare industry during this podcast, it would be great, Markus. Okay?
Okay,
Can we
well,
do
we're
that?
working on that. Our mission actually is reinventing healthcare one system at a time. Unfortunately, there's a lot of systems that make up healthcare, so we might have to revisit this in a year and see how we're doing.
Before we get started, I do want to remind everybody that today's podcast is brought to you by Fullscale. If you need help doing software development, that's what my company does. We have 300 employees in the Philippines, helping dozens of other tech companies, front end, back end, mobile, QA, whatever you need help with. And check us out at fullscale.io. Well, Markus, welcome to the show, man.
Yeah, thank you. Thanks for having me.
So I think I read here you've been in the healthcare industry for 3 decades or something, long time.
Yeah, it's funny. I officially started in '89, but I kind of round that up so it doesn't put me in the 4 decade mark. But I started my journey way back when with a company that's not here anymore. That was probably one of the largest technology solution providers at the time, called EDS, or Electronic Data Systems. And it's funny, as I talk to people, I almost get a little defensive when they don't know EDS, but EDS was a great company that did it right, and I frankly still owe a lot of my success to EDS. But I came out of the gate with EDS doing healthcare, building large claims processing platforms for Medicaid. The funny thing is, a lot of those systems are still in play today. So, what is that, 30 plus years? I'll just say that. But yeah, I've been in the healthcare journey, health IT journey, my entire career for quite some. I've seen it all now. Started, we were doing green screens, and there was no mobile phones, there wasn't even internet, and look at us now. It's evolved considerably.
Well, I'm based here in Kansas City, which is actually one of the hubs for healthcare tech. We're home to Cerner, which is now Oracle, bought them for billions of dollars. And there are a lot of healthcare related companies here in our area. Over the last, 25, last 3 decades or whatever you've been working on this, how has healthcare changed, and how do you think generative AI is changing it now?
Yeah. Well, so I guess two questions there. One, I can't say healthcare has changed that much. I mean, some of the processing and the business rules and how you process the claim and price the claim, a lot of that stuff really hasn't changed too much since at least I got my start. Generative AI obviously is I think, game changing. I mean, 2 years ago we started talking about AI. I was skeptical, and here's the latest buzzword, and everybody's going to jump on it. And AI is in this company name and that company name. But I'll tell you what, I've officially drank the Kool-Aid, and we're investing heavily ourselves in generative AI. We'll talk about it a little bit more later, but one of the things our platform does, and that's what Empara is, it's a health engagement platform to really help individuals navigate their entire healthcare journey, from their medical plans and their pharmacy plans and dental plans and vision plans. And as you know, I'm sure you're insured yourself, these plans are quite complicated. You open up your plan documents, there's 20, 30 pages long, trying to explain in network versus out of network, and in coverage, out of coverage. And we've been using and embracing generative AI to really simplify that process. You open up those plan documents and they almost look like a legal contract. Using generative AI, we can ingest those along with your accumulators, such as, where are you with your out-of-pocket max for the year, your deductibles for the year, and provide a highly curated response. So you don't have to sit there and call somebody and try to get a simple question answered. For example, I broke my knee. I need to go to urgent care. How much is this going to cost me? We bring back a nice curated response to help members kind of navigate the system so they can avoid some of the landmines that may result in a nice big bill at the end of the day. It's kind of endless that where generative AI is going. That is our particular use case.
Well,
One
let
of
me
our,
ask you this. Let me
yeah.
ask you this. I mean, generative AI is great. It's not always accurate. And, is healthcare a segment where it's kind of dangerous to use generative AI because of the accuracy of it?
Well, I would say, that's a great debate, and I think it's getting more and more accurate over time. I do think, and we ourselves would make sure one Empara is part of a family of companies called Goodroot. You mentioned I serve as CIO at the Goodroot level. One of our affiliate companies is a benefits navigation company, which is basically think of them as a concierge company you can call and ask them any question you want. They just kind of help you with any questions that you can't answer through our
Mm-hmm.
portal, through our generative AI, let's just say. But they help me with everything. I don't have a dental bill, didn't get paid. I'd take a picture of it, send it in. They run it down. I say that because we make sure we do not use any generative AI for any kind of clinical type
Okay.
recommendations. So for us, and several of our affiliate companies have embraced AI, it's more around operational efficiencies. So, even in our little world where we are providing a curated response around your health plan, we make sure there's a disclaimer in there. I think one of the great use cases that are very popular in healthcare right now is in the doctor's office when they're recording all the notes, the nurse notes and the doctor
Right.
notes, and through AI techniques. And that's been a game changer for a lot of reasons because that is highly accurate. Now, if it's going to look at all those nurse notes and make a recommendation on what to do, then I would probably steer away from that for the foreseeable future. But the operational efficiency gains that we're getting is, I think, where the real value is for right now in healthcare.
So most people don't realize that it's like 70 or 80% of all health insurance in the United States is self-insured by the employer, right?
Right.
And but is it really that high if you include like Medicare and VA and all that kind of stuff too? Because aren't those are huge pieces of it?
Well, they're huge too, and typically when we talk fully insured versus self-insured, we're kind of talking about the commercial market where you still got the big health plans where the Blue Cross and the Uniteds and the Cignas play, and there's a lot of
Yeah.
regional health plans, and there's some very new innovative type health plans coming to the market. You may have heard of terms like reference-based pricing, and frankly, where I think the disruption is going to move is to more consumer-based, cash-based pricing, where doctors will provide a cash price. You probably have heard in the last couple of years this big national transparency and coverage
Yeah.
ruling that's now requiring the third-party administrators and the health plans to provide total transparency into how much everything costs. So when you start talking about Medicare, although that is huge, and even Medicaid, that the self-insured typically play in that commercial market for
Yeah.
your employers.
But
Medicare is obviously more the retired, and the Medicaid is the underprivileged.
the problem is obviously is everything to do with medical and health insurance is just crazy expensive. But I don't feel like anybody wants to make any of it less expensive. I don't feel like the insurance companies have any interest in making anything less expensive because they make a percentage of it, right? They want to make 10% or whatever they're allowed to make. So they want everything to be as expensive as possible, so they make 10% of the bigger number. Like I feel like there is no incentive by anybody to actually make it less expensive.
Yeah, well, you're absolutely right. I would say the big health payers are probably the last that would disrupt the cost, but there's definitely an incentive for the United States to change. I think when you start looking though between the lobbyists and I mean these big health plans are all Fortune 50 companies, so they've got a lot of power, a lot of influence, and but at the end of the day, you said 70% of the market is self-insured, so that means that the employer group is actually paying the bill. They're
Yeah.
making their bets that they can do it cheaper than going fully insured, paying a United Healthcare 2, 3 grand a month or more per employee. If you think about it, and you got 100 employees, that's not a large employer, but you're talking about $3 to $3 million to fully insure that group. Most of that self-insured market, the 70% that you mentioned, those are generally larger employers. Those are your employer groups that have 250 employers or higher.
Yeah.
The smaller employers, the 150 or less, they're kind of stuck in that fully insured space. And I think that's really where there's going to be huge opportunity is how can you bring some of the self-insured advantages to that smaller employer size. We haven't cracked that nut. The main reason is really the underwriting, getting what they call stop loss. So, one bad claim a small employer cannot afford one small claim that goes sideways, right? You've got a critical illness or an accident or something like that, and you may have yourself easily $100,000, $200,000 claim on your hand. So that's kind of been one of the biggest challenges.
Well, and that's part of what you guys are trying to solve, right? You're trying to make it so a company like, let's say, Full Scale had 500 employees. Like, how do we educate our employees to do a better job at what medical services they pick so they're less expensive for Full Scale since Full Scale's actually paying the bill, right?
100% right. Yeah, and that's kind of how Empara even started. One of our affiliate companies was trying to solve the problem I just described, bring in different strategies to bear for the smaller employers, and they kind of ran into those same headwinds I talked about. It was hard to get some of that underwriting completed on those small plans. So Empara evolved, which is really a health engagement platform for members so they avoid some of those, rabbit holes that end up in these balance bills, frankly, just because they're not educated. The interesting thing, when I say that they're not educated on all the different services they have, because it's just complicated in general, what's fascinating is employers pay for a lot of these interesting solutions that can drive cost savings. Once again, the employer's on the hook in the self-insured space, so they want to bring strategies to their employees to help them, ultimately save the member money and save the plan money. The problem we're finding, and one of the big value props in our own technology platform, is that members don't even know about it. So it's like a double whammy. The employer's paying for it to save themselves money. There's no utilization of these point solutions. And I would contend because often members don't even know they have these point solutions. And so it's just like call it a lose-lose. What we do at Empara, and we do a lot of different things, and we can delve into that. But one of the big things we do during implementation is understand all those different services that the employer signed up for their employees. Telehealth, there's all kinds of interesting pharmacy, cash networks and cash cards and even sourcing of drugs internationally. Ton of different strategies that are out there, but the member needs to engage in those. And if they don't know they
I
have them, then it doesn't help anybody.
I think the answer to most of them is to get on a plane, go to another country, have the service, and come back.
Yeah, yeah, that's one potential opportunity there. I don't know. I'm sure there's some pitfalls in that as well. I don't think it's quite as easy. But no, it's funny. I have a lot of family in Europe, and you start saying, is that a better, is that a better system? Got a lot of friends that are from Canada. I'm always asking, is that a better system? It sounds great. They would all of them say it's a big mess. It's a hot mess as well for different reasons. So I don't know. It's strange. I just think in general, healthcare is just so complicated and there's so many layers. I mean, it's really interesting, right? If you go see a doctor, I don't know if there's another service where you go see a doctor and you don't know how much it's going to cost you until 3 weeks later.
Yeah.
I find that really fascinating. I
Well,
mean, pharmacies kind of solve for that. You don't get your drugs until you get the claim adjudicated. You pay what you got to pay at the pharmacy, and then you take your drugs. You go and see a medical doctor, whatever it may be, you find out 3 weeks later you're on the hook for $6,000 because you really didn't understand that this particular procedure wasn't
yeah.
covered, and so on.
Well, I have a little bit of a different perspective of this because at Full Scale, we have 300 employees in the Philippines. So we pay for insurance there, we self-insure it there, we do all that. And I've been to the hospitals there. My sister-in-law had a baby there. Like I've seen all this different stuff, like good and bad. But one of our employees had something very unfortunate happen to one of their children, but they were not. the ICU for like a week, and at the end of the week, like the entire hospital bill, I think was like $2,000 or $3,000. Um, just totally different world. And for us to provide HMO insurance for our employees there, I think is something like $60 a month per employee. That's it. Just totally different world.
Well, in your experience, so it's funny, you were talking about flying in different countries. I guess
Yeah.
that's from personal experience. Was the quality of the doctors? I mean, did you have any concerns when you were over there with that? Especially, I think your sister-in-law, you said, had a child over there. Did you have, I mean, to me, that might be one. That's one of the things I've heard. You want to be able to, they say you want to be able to see whatever doctor you want to see. That's obviously not the case. You can see whatever doctor you want to see that's in your network, but not any doctor you want to see. So, did you feel the quality and everything and the timeliness of being treated was on par?
I mean, generally speaking, I think it's good. I wouldn't say it's the best in the world, but I'd say it's good. Would I rather pay 80% less and have good? Probably.
Yeah.
We would
Well, and
probably be
funny, the
better off.
definition of good is, I think, for debate.
Yeah.
We talked earlier about this whole transparency and coverage rules, and a lot of these big, companies that do this transparency work, the Talons and the healthcare blue books of the world, they also have a big focus on provider quality, and they do scoring around providers. And it's funny, I about a year or two ago, I moved for the first time in like 20 years, and now at my age. I have a higher reliance every year to go see my primary care physician and a dermatologist and my dentist. And moving, although I only moved an hour down the street, I had to find all new doctors.
Yeah.
And I'll tell you what, that was about a 4 to 6 month journey. I'm still not sure if I found exactly who I'm comfortable with. In my area where I live, a lot of these concierge doctors have taken root, and they seem to be ones that I probably would want to go see. However, I don't want to pay twice. I don't want to pay my health plan over here and also pay a concierge, 4 grand, although it seems like a good model for primary care. So I guess the definition of a good doctor is somewhat subjective. Is kind of where I'm going.
So tell me a little more about Goodroot. You mentioned before they have a whole portfolio of companies, and I love it when I hear, well, we were trying to solve this problem and we couldn't figure out how to do it. So we decided to start a company doing that, and now it's another thing that we do. Like usually that's where some of the best entrepreneurial ideas come from.
Yeah.
Tell us a little more about Goodroot and kind of what you guys do at a higher level.
Yeah, Goodroot's listen, I feel highly blessed being a Goodroot. We are a very innovative company, which I love. And we're laser focused on trying to solve some of these problems we're talking about in healthcare. I arrived at Goodroot probably 4 years ago, working with a very specific company that was building out a solution to kind of do integrated cash. And there's a lot of savings at the pharmacy paying by cash. That's where these companies like GoodRx and Single Care and they kind of all spawned out of that. So they were doing some very innovative things where you could do integrated cash, but even at the PBM level. So I kind of came in to help kind of design that. And that was my introduction to Goodroot. And at the time, Goodroot probably had 6 or 7 what we call affiliate companies. And what Goodroot really does is they've hired a best in class team that does a lot of the, your legal and your finance and accounting and a great marketing team and sales team and HR team. In my case, I kind of lead the IT work both on the technology side as well as the security side. And then we bring these companies in that've got a great idea. Sometimes they show up at Goodroot with nothing but an idea and they haven't done anything yet. And other times they're a small business. They may have 3 to 5 employees, maybe a little bit more, but they've got a very innovative idea that can really move the needle in healthcare. Goodroot embraces them, empowers them, and amplifies them through the Goodroot team. And then they can really just focus on, the operations of their business. And it's been an unbelievable successful model, number one. And number two, some of the ideas are just incredible and really have an impact in healthcare. One of my favorite is a company we have called Breeze, and they bring solutions for hospital financial assistance. And I've been in health IT, as I said, for 30 plus years and didn't even know hospital financial assistance was so readily available. Um, you know, the vast majority of hospitals are nonprofit across the country. And as part of having that nonprofit status, they're required to offer up a substantial amount of hospital financial assistance. And most people don't even know that. The hospital's not going to really let you know. It's not like a big neon sign in the front, because any money they don't give out kind of hits the bottom line, and they're not being held accountable, frankly, by the IRS or anybody else, which that's a little bit of a, call it an opportunity there someone needs to delve into. But even as an individual, if you're on an insured plan and you go to a hospital and you end up with a $10,000 bill, there's a very good chance you could qualify for hospital financial assistance. It turns out you could be making like 4 times the minimum poverty level, and still get hospital financial assistance. So that's an example of one of our companies. We bring that into Empara as a feature. So any of the companies out there that use Empara, we have the ability to light up hospital financial assistance. We've got an employee navigation company. We have an unbelievable payment integrity company, which is huge. Auditing these provider bills, these complex provider bills, and they're bringing some awesome technology to help and improve the whole payment integrity space. And then we've got 2 or 3 interesting solutions on the pharmacy side as well. So, you know, we had all these great independent solutions, and we've always kind of struggled of how do we package these together? Do we package them together? Many of them on their own right have a lot of value for members that are insured. And so in part, it kind of evolved as this is a technology platform to not only stitch together some of these cool solutions, but a lot of the other great solutions that are out there being offered out by TPAs, brokers, or
Hmm.
otherwise.
So tell me this: like you're building a whole suite of great products and solutions. How do you guys sell this stuff? What is the go to market strategy for selling this? I mean, obviously your dream is to sell it to Walmart and some giant companies that have like millions of employees. How do you sell this stuff?
Yeah, it's not easy to sell it. Part of the Goodroot Amplified Services team is our commercial sales department, who is led by a lady who's just got a wealth of knowledge and experience. But we're selling to a lot of different areas, right? You're selling into health plans in some cases. You're ultimately selling to employer groups on the other case, which means you generally have to go through a broker. You have to go through potentially a TPA if they're self-insured. Brokers have both fully insured and self-insured, or direct to market, right? Whether it's a large captive or union groups, and the list goes on. We're even finding Empara was built highly configurable, so it's even has very specific use cases. As in, one of our customers uses it as a HIPAA compliant messaging center, just to communicate through professionals in the healthcare industry and be able to transmit back and forth important information in a secure fashion. So selling it is a challenge because we've got such a large breadth of
Yeah.
opportunities. How do you focus? And frankly, that's an ongoing conversation. So if you've got the silver bullet on that, let me know. But right now, it's just grinding it out. Going to the trade shows. We've got fortunately a great marketing team. We do a lot of these kind of podcasts. We do a lot of messaging, and we just get out there and network. The interesting thing is any one of our customers is potentially an opportunity for another one of our customers.
Right.
And so we do a lot of cross selling, which is great.
Well, what is it like building this technology? You're the CIO. You're on the hook for building this stuff and dealing with all the regulations and security and all these different things. How hard is it to build technology in healthcare at this point?
Well, I'll tell you, I would say it's a lot easier than it used to be. And why I say that is because with the evolution of cloud and platform as a service and a lot of these new modern development platforms, a lot of the piping and plumbing that we used to have to build out manually, once again, I've been doing this 30 something years, um, are kind of there, more readily available. So you can kind of plug some of these services in and kind of fast track some of the build. I
Is
think
that
the big
because is that because you can just deploy it to, a special version of AWS and then you just when everybody asks the questions, you just point like, I don't know, we use AWS, it's secure? Like how
Well, security is a whole nother animal. I wish it was that simple, but it's not. Security is one thing, as we just witnessed, this last week here with the whole CrowdStrike thing and Microsoft thing, the ability to patch. All you were trying to do is put a simple patch down on a
Yeah.
computer for security reasons, and look what happened. I wish I could point my finger at AWS. And we actually live in 3 different data centers across our companies.
Oh, geez.
We've got considerable assets in Azure, we got considerable assets in AWS, and we're also in the Google Cloud. Empara lives primarily in Google Cloud. Some of our other companies live predominantly in AWS. So that adds a little complexity for me right out of the gate. That's a whole nother podcast on how I got to that place in the first place. It wasn't strategic.
That sounds like
Um,
a nightmare, not a podcast.
it is a nightmare to some degree. I mean, actually, I think there's different tools for, and each of them got things that are, better than others. So we're strategic in picking out the right tools for what we're building. But the security thing still is a big burden on us as a company.
Yeah.
So we go through a lot. I spend a lot of time, and right now it's security season. This year we went through the holy grail of security frameworks and audits called High Trust. I've taken 3 swings at different companies going through that, and it's such a large journey that this is the first time I've actually ended up on the other end of it. And our payment integrity company got High Trust certified this year, which is a huge accomplishment. But that was 2 years to prepare and get ready for that, which is just an insane amount of resources.
And do all
And
your customers require that? Like hey, we're
not
not going
all
to do
your
business with
customers,
you.
not all your customers, just a few, and they're usually the larger health plans. And I'll tell you, if you were to ask a high trust auditor, they would say it's such a big lift. Make sure more than at least one customer wants that. And if it's just one customer, how valuable? Because it is a big lift. Generally speaking, we go through SOC 2, Type 2 every year, and we go through a HIPAA security risk assessment every year. And those are our 2 leading frameworks. One company, High Trust is very specific to a service or an application. So of all our Goodroot services and products, one of them is High Trust certified.
Okay.
So that's the other thing. It's not like we got a nice rubber stamp that cascades. But for all our affiliate companies, we go through HIPAA security risk assessments every year. We go through SOC 2 every year. We do penetration tests, vulnerability scans, and that's just scratching the surface. There's a lot of expense and a lot of work that goes into making sure we're secure and our customers' data is secure, but you got to do it.
Well, it adds a lot of overhead just to be in business. Like, what do you
Yeah.
think that costs you a year? Is it 100 grand, a couple hundred grand a
Well, no, it's in
year?
the
Like,
6 digits for sure. Now, I'll tell you, 10 years ago, or probably 7 years ago, we had our own co-location facilities with servers and racks
right.
and all this and that. So the fact, like you said, that we're kind of living fully behind Microsoft, Google, and Amazon's kind of security center has been a big help. We can use those SOC 2 reports for inheritance. Gives us a lot of runway when it comes to the technical controls and physical access and all that kind of stuff.
I mean, I always enjoyed that part of it. People were like, well, is your stuff secure and this, that, and whatever. I was like, Microsoft's better at it than me. Like, I use
Well,
Azure. So,
they secure a lot of stuff, but it still comes down to your application and
yeah.
having the proper controls in your application because anybody can get through like the old days cross-site scripting and SQL injection and get to your data. I mean, it happens, and the most what you would consider the most secure companies in the United States, big healthcare companies, Change Healthcare most recently. Someone got in, and the thing that drives me crazy, Matt, is the amount of money, and it's well north of 100,000, and we're not a huge company. The amount of money we put in all these security controls, I guess call this a public service announcement. It's still going to be someone on your team that clicks on a link in an email that
Right.
90% of the time that's going to cause that vulnerability. So I don't know how you protect against that. We do quite a bit. We do a lot of phishing simulation and enroll people in security awareness training and two-factor authentication. I even worked for a company where we had all those controls in place. We had two-factor authentication. A user got the alert on their phone and acknowledged it, and that they were the ones logging in when they weren't. And I don't know how you can even protect against that. So it's never ending. It's never ending, but it causes a lot of other problems as well in healthcare, and that's just in integrating partners together and systems together. Because as a result of that, there's so many privacy and security rules that the sharing of PHI is highly problematic. And I'll,
Yeah.
and I'll point my finger at our government because we haven't solved for patient identification yet, especially when it comes to healthcare. So there's no unique identifier for Matt Watson or Marcus Waite. And what a
Your
lot of
social
people
security
don't
number.
know, you can't use social anymore. I spent a lot of time in the work comp industry, and
Okay.
one would argue 10 or 20% of the socials that come through are either fictitious or stolen. That industry is ripe with that, so you can't really use that anymore. But what's insane is a lot of the biggest companies in the world are still doing like fuzzy matching to match on patients.
Well, there's a lot of people in this country that don't have a social security number,
There's a
or
lot of
just
people that
somebody
don't have
that's,
Social Security numbers. That's
or
right.
be there, they're, or there's people that are just on vacation and they just happen to
Right.
end up in one of our hospitals, right?
That's
Like,
right. So it's makes the whole thing kind of complicated, and the sharing of data. I was very hopeful back when Obama was pushing the whole health exchange. I was like, okay, this is gonna be great. We're gonna have a repository where all my medical records live, and that never. I still track all my lab results on an Excel file, believe it or not, just so if I go see a new doctor, I can look for my own trends. Why the doctor's not doing that? Because they don't even keep a history of it. It's craziness. So those little things that we identify and try to at least plug into some of the tools and products we bring to the market.
well, I love what you guys are doing, and anything that helps reduce the cost of health insurance is so important that, I feel at this point, every business in America and really every person in America is a huge disadvantage at this point simply because of the cost of health insurance. As a business owner, it costs $1,000 to $2,000 a month to provide health insurance for a family, right? For just an individual, maybe it's $400 or $500 or whatever. But for a family, I mean, it's expensive. It's like $1,000 to $2,000. The reality is, you can hire people overseas for $1,000 to $2,000 a month
Right.
for their entire
Right.
salary, benefits, everything,
Yeah.
everything. Right? Like that puts American workers at a significant disadvantage because the simple healthcare costs are just
Well,
astronomical.
and this is what really happened too. So yes, call it $1,000 to $2,000 a month, which is really not affordable for many people, for the employer or for the member or the employee. So what employers have done is they've cranked up those accumulators, right? Real high out-of-pocket max, high deductibles. That's very, very common today. So if you got a $7,500 deductible and a $10,000 out of pocket, that's a lot of money. You end up with a bill of $6,000. That's medical debt. I joined Goodroot, and all we were talking about was we got to solve for medical debt. We got to solve for medical debt. I thought medical debt was I got a hospital bill with 100 and I owe $150,000. It's not. I'm like most workers out there, and let's just say I'm making 80 grand a year, which is a respectable income, and I got a $7,000 bill, and that now how am I going to pay that? That's medical
Yeah.
debt, and there's so much of that
So,
going on.
but didn't they just pass a law that medical debt's not going to show up on your credit report?
They did. I guess that's one good thing. You still got
Does that
medical
so does
debt.
that mean nobody's going to pay it? Or
I
they get a
don't
medical
know.
bill and like, why would I pay this thing? What are they going to do?
Well, I'd probably argue if you got medical debt, you probably have a lot of other debt as well. You probably have credit cards. Today's world,
But
we
if it
live.
doesn't show up on your credit report, what are they going to do?
Well, are you suggesting that for all the listeners out there that have got some medical debt, I guess just deprioritize it?
I don't know. I
Yeah.
just asked the question.
I don't know. I'm
I
not
don't
gonna, I'm
know.
not gonna put my speculation on that one, but it is a very good question. I was aware that they were passing that. I don't know if it was officially passed or not. It's hard to keep up with all that.
Yeah.
But that is a great question, Matt.
I feel like if anything, it's going to make it worse because there will be
Yeah,
some people that decide, well, whatever, I'm not going to pay that.
I
So then it
know.
drives up the expense for everyone else.
Yeah. No, it's out
So
of control for sure. So we're
is
we're doing what we can do to chip away once again, and it's definitely a long journey, but we're seeing some success. So that's good news. Keeps
well,
us.
I really appreciate having you on the show today. Again, this was Markus Waite, president of Empara and CIO of Goodroot. Thank you so much for being on the show today. As we round up the show today, do you have any final words of wisdom, other tips
I
for?
mean, listen, I would just say, people need to understand their benefits and to avoid the medical debt that we were just talking about. Healthcare is highly complicated, so any of these technology platforms, Empara is just one of several out there that can help you understand your healthcare journey. I would definitely encourage, individuals and employers to take a look at that. And Matt, I appreciate what you guys do because frankly, getting some of these messages out does have an impact. People hear something we're talking about, and someone will reach out to you, me, or somewhere else because they recognize we got to change. We can't stay status quo in what's going on. And I think there's some big changes on the horizon. Like you said, there's some big players out there that don't want the change, but there's tens of millions of individuals that do want the change. So I
The
think that we're going to see some positive movement here sooner than later.
The government's got to step up and do their job and be like, hey, we're more of a single payer when it comes to drug cost or some of these things or something to fix the cost and the pricing. Like they got to do something.
Absolutely.
So,
So thank you, and I appreciate it.
all right, thank you so much for being on the show.
All right. Take care. Bye bye.